Welcome to the Aging Process, developed for you by Educare. My name is Jean Howell. I'm a licensed RN and have worked 35 years in the healthcare industry. My passion is to help train caregivers in customer service and to inform you of the various aspects of aging so you can understand the clients you are serving and provide the very best service possible. The learning objectives for this training module include: state the basics of body functioning and describe changes that may occur. 2. Recognize physical, emotional, cognitive, and developmental needs of clients. 3. State tips for working with clients who are experiencing changes. Understand the importance of dignity and respect despite changes. And 5th, overcome common myths of aging. An important part to remember about aging is we want to recognize each client's abilities rather than their deficiencies. And we are going to be going through some pretty significant changes that a person can experience as he ages. And it can sound kind of depressing as you think that all these things are happening. So let's focus on their abilities and not their deficiencies. In recognizing each client's abilities, we want to treat them with respect and dignity. It's important to know the client's history, lifestyle preferences, and social history. Their history may include coming from the Depression era. They may be immigrants or their parents were foreign-born. They may be women who never worked outside their home, or women who had a full career. Some are widowed, divorced. Perhaps there have been multiple losses in their life. Lifestyle preferences can include extensive travel, gardening, entertaining. Perhaps they own more than one home or even rented in an apartment most of their life. They've been involved with family, and now the family is busy with their own family, and everyone is working. Maybe the family has moved away. Their social history can include their involvement in their community and church. They kept up with lots of friends, and now most of those friends are gone. They have liked music and theater, but now they are unable to attend. They've liked to read. They belong to book clubs, but now their vision is impaired. Given that, we want to promote their independence because when seniors feel independent, it enhances their self-esteem. There are certain changes in a person's body that are the result of normal aging and others of a disease process. Signs of normal aging can affect the person's ability to function independently, and this is where you impact their life. The client relies on you to assist in promoting and maintaining their dignity by helping them to be as independent as possible. I'll probably say this more than once, but we never want to do for the client what he possibly can do for himself, even if it is to save time. First, we're going to talk about some changes in the client's skin. Skin becomes less elastic as a person ages. It gets to be wrinkled and loose, and it's much more likely to bruise and tear. The layers of the skin become thinner. It's almost like a real thin saran wrap. There is less subcutaneous fat. The fat stored under the skin decreases and affects the body's temperature controls. It's not unlike the animal in the Arctic that has a thick layer of fat underneath his fur and stays warm all winter. Well, as that fat decreases, you feel the temperature and coldness much more readily. There is less moisture in the skin, so the skin is very dry. There is less oil and sweat produced, so you want to keep lotion close by at all times. Finger and toenails are thicker and develop ridges. These are normal or potential changes you will notice as a client ages. Based on these changes, I'd like to offer some tips for helping a client with skin changes. Check the condition of the client's skin and report any changes to the nurse. What you'll want to report is any excess warmth, swelling, redness, bruising, or skin tears. It's not important for a client to bathe every day unless it's recommended by a physician. It just adds to the drying of the skin. After bathing, help him with applying lotion. Here I want you to think lotion, lotion, lotion. Every time you get an opportunity, apply it. Never pull a client, especially when helping them out of a chair or the bathtub. And please remember to use proper lifting and transferring techniques at all times. You'll want to use caution when assisting a client with shaving in order not to cut their skin. The second area of change is with vision. As a person ages, farsightedness develops. Usually after about the age of 45, most adults have difficulty seeing objects up close, meaning that some will not even be able to read the daily activity schedule or the menu. Visual acuity declines. It is difficult seeing in dark or dim light. Glare will affect vision and common eye disorders develop. For instance, cataracts and glaucoma become more common. Just for a little information, cataracts are when the lens of the eye shrinks with the loss of fluid and vision becomes cloudy. But there is a treatment. You can replace the lenses. Glaucoma is far more serious. It's a group of eye diseases where the pressure builds and the optic nerve shrinks, possibly resulting in blindness. Perceptual vision changes also occur with those who have memory loss. With a dementia-like illness, the client may think that they are seeing something differently than it actually appears. It's a cruel trick of dementia. Remember, it's the result of dementia and not visual changes of normal aging. Here are some tips for helping a client whose vision has changed. Make certain the environment is well lit at all times. Turn on all of the lights and the lamps. This is not the time or place to save on electricity. If possible, use contrasting colors so the client can distinguish areas. For instance, using a colored tablecloth will help the client to see the plate at mealtime. When writing something on your client's activity calendar, be sure to use large letters. Use a large font. Make certain the client who needs glasses wears them. Help him by cleaning the lenses of his eyeglasses regularly. A good practice is to clean his glasses every single morning, and if you see him throughout the day, add an extra cleaning. Also, you'll want to report to the nurse any sudden vision loss that you are aware of, or that the client talks about. The third area of difficulty is hearing changes. Differences in sound are much harder to distinguish. Changes in the structure of the ear make it more difficult to distinguish different sounds. There's a decreased ability to hear when background noise is high. Loud noise or commotion makes it difficult for words to be heard. Clients with hearing aids pick up a lot of background noise, which is very disconcerting for them. Consonants are harder to hear than vowels. Words that include the letter F, such as fulfill or defer. The letter S, such as in the word succession or prosper, would be hard to distinguish. Or the TH sound in rhythm or further. Also the CH in psychology or T as in Tom. The letter P as in Paul or in the words push or purpose are harder to distinguish for people with hearing loss. Helping a client with hearing deficiencies can be challenging in a healthcare environment. So here are some tips that may help you communicate with a client who has hearing changes. Always speak slowly and clearly. Be sure to approach each client and make eye contact so they are aware that you are speaking to them. Many seniors get used to reading lips to compensate for hearing loss. Use their name so they know you are speaking directly to them. Try to eliminate background noises that interfere with the client's ability to hear. It may be easier and necessary to ask him to move to a quieter area in order that you may hear him and he may hear you, than to eliminate background noises. I had a client with advanced Parkinson's. She was bent over in her wheelchair, pretty much unable to lift her head to establish any eye contact. Her mind was still quite sharp, but her speech was failing. Extremely soft, muffled, slurred, very hard to understand what she was trying to tell me. I got down on my knees so I could be closer to her face, trying desperately to understand what she wanted. With the background noise in the dining room, it was impossible for me. She agreed to have me come back after lunch when I could take her to her quiet apartment and we could talk. I want to think I have pretty normal hearing, and yet coupled with her soft speech, I couldn't hear what she was saying. Be aware of your client straining to hear, asking, "What did you say?" or "Huh?" Be aware that sometimes hearing loss gets mistaken for depression. When you can't tune in to your environment, you can become withdrawn, falling deeper into your internal world with fading interest in what's going on around you. If you notice a client who is not engaged, share your observation with the nurse. An assessment may be needed. You can assist a client who requires a hearing aid by making certain it is clean and in good working condition, just like his glasses. Make certain that the client wears it. If you are unsure on how to turn a hearing aid on or off, or how to replace a battery, please ask. Hearing aids have a bad habit. They get lost, so make sure you do your part in always placing it in a container or a dish. Same place every time it is removed. Again, use simple statements and give the client a chance to process the information. Speaking with long, complex sentences and speaking fast only decreases the likelihood that the client will hear you. The next area I'm going to talk about is assisting clients who have had changes in taste or smell. The ability to taste decreases as taste buds gradually lose their effectiveness. However, many seniors prefer sweets because they can still taste them. The taste buds for sweets are least apt to deteriorate. I don't know if this is good or bad news. The ability to taste decreases as it is directly linked to the ability to smell. For instance, have you gone into the lobby of a movie theater and smelled popcorn, and you have to have popcorn? Also, have you ever noticed a child holding his nose when he has to eat something so it won't taste so bad? Broccoli, for instance? Our ability to taste is directly linked to the ability to smell. If a client's dentures are making noise or clacking when he talks or eats, be sure that the dentures are fitting properly. Actually look into the mouth to see if there are any sores or if the mucous membrane is reddened. Report this and any sudden loss of appetite to your nurse. Some tips now for helping a client with changes in taste and smell. It is important to make certain that all the food is presented in an attractive manner, so the client feels invited to join the meal. Make certain that the food is easy to eat. Food that is easy to chew is more likely to be eaten. It is a much better practice to cut up the chicken in small pieces rather than put an attached thigh and leg bone on the plate at one time. Offer clients dessert after each meal. Dessert will most likely be eaten, so it's important to encourage the client to eat the main course first. And attention needs to be paid to the diabetic client and offer him low sugar or sugar-free alternatives for dessert. You'll want to check the temperature of the food to make certain that the food is served appropriately. Hot food should be served hot and cold food should be served cold. If a plate of food has been set up in the kitchen and not served immediately, it will lose some of its pleasure when it's lukewarm. Serve smaller portions. Even serve it on a smaller plate. Don't overwhelm a person whose appetite has decreased to eat an enormous plate of food. The next area I will talk about are changes in the muscles and bones. There is a loss of calcium in the bones. This is a deterioration of the joints, and as joints break down they become stiff and movement becomes much more difficult. Think arthritis. Muscles lose elasticity. Our total mass and our muscles become less flexible and shrink, which reduces our overall strength. One of the most severe changes you can experience in the aging process is osteoporosis, and that is simply the loss of normal bone density that causes bone tissues to thin and tiny holes to form in the bones. This condition is most often found in women who have gone through menopause and people who are inactive or paralyzed. I think back 75 years when my mother gave birth to her first child. She was in the hospital 2 weeks. When I delivered my first child about 45 years ago, I was in the hospital 3 or 4 days. And now, new mothers are barely in for an overnight stay. But the principle is the same, and it doesn't all have to do with insurance reimbursement. It has been found that, through time, putting weight on bones strengthens bones, and if someone lies inactive in a bed, they will lose bone density. Here are some tips now for helping a client with bone and muscle changes. Allow the client to change positions slowly and encourage him to participate in some form of exercise. We know so much more now about the benefits of physical activities. Just walking is a wonderful activity. And they can do armchair exercises. Just get movement going. Make certain to reduce the risk for falls by removing all trip hazards and immediately clean up. Another area of change in a client is in the cardiovascular system. The size of the heart increases with age, making it more difficult for the heart to pump, and that would affect circulation. His blood vessels thicken and become less elastic, and this thickening and decreased elasticity of the blood vessels interferes with the function of the heart. There is less cardiac output. With age, the pumping of blood decreases, and it takes longer for the blood to circulate. And there are often fatty deposits which form in the heart and blood vessels. That can be caused by a variety of factors. Now some tips for helping a client with cardiovascular system changes. Assist the client with ambulating and encourage rest periods. Several short walks down the hall are much better than one long walk to the elevator and then to the dining room. Follow your nurse's directions regarding taking blood pressures and report any changes to your nurse. Assist the client in protecting their hands and feet. Make certain they avoid extreme temperatures and receive proper nail care. And you'll want to assist to dress properly to maintain their body temperature. Watch for mental changes. Changes in the heart's ability to pump can affect the brain function. Our brain needs more oxygen than any other organ in our body, so if it's not getting sufficient oxygen, the brain will act sluggish. Speech could become garbled, the person may feel lightheaded or dizzy, and they may not understand even our simplest requests. Report to your nurse any swelling you see in any area of the body, particularly the lower leg and feet. Do all you can to maintain a healthy lifestyle and monitor the health of the clients that you're caring for. Another system of the body that changes is the respiratory system. As a person ages, the lung tissues become a little more rigid and breathing becomes shallower. Lungs do not expand fully, so the lung capacity decreases, which makes breathing harder, and there is also a greater risk of developing pneumonia. A tip is to encourage a client to participate in some form of exercise on a regular basis, just as we did with bone and muscle changes. If a client says, "I'm tired," take a rest, don't push. If he says, "I'm out of breath," have him rest, take a pause, take a nice deep breath, let it out, pause, take another breath, let him get his breath back. We all know that smoking compromises the respiratory system. If you have a client who smokes, he knows that too. I don't think there's much you can do to get him or her to stop. I've known people who were diagnosed with lung cancer who smoked until the very end of life. Our job is not to judge someone else's choices or habits, but to be supportive and understanding of the limitations to the quality of life caused by smoking. With clients who have COPD, emphysema, congestive heart failure, encourage activity, but don't push. Another area of change is the urinary system. There is a loss of tone to your bladder and your muscles controlling urination. The changes cause the client to urinate more frequently. Also, the bladder may not empty completely, which can cause incontinence. Often a person may not feel the bladder needs to be emptied. There is a decrease in the size and less blood circulation to and in the kidneys, making eliminating urine more difficult. The bladder seems full, but it's difficult to empty completely. This often causes increased risk of urinary tract infections. Some tips now for helping a client with his urinary changes. Encourage the person to drink plenty of fluids and establish a regular schedule for those folks who require assistance with toileting. Consistent, regular emptying of the bladder can help train the bladder to empty on demand. To reduce the occurrence of a urinary tract infection, assist the client to practice proper personal hygiene. Any changes from normal urinary habits need to be reported to the nurse. Report any signs and symptoms of a urinary tract infection. Some of these signs and symptoms could be complaint of burning upon urination, an urgency to go to the bathroom, any blood in the urine, an increased frequency to urinate, or any complaints of chills or fever, and any nausea or vomiting. Behavioral changes can also occur with a UTI. Irritability, withdrawal, hostility can be signs and symptoms of a UTI. Learn how to provide proper pericare to ensure that the client you assist will avoid infections and skin breakdown. The next system is the nervous system. With aging, there's a decreased blood flow to the brain, and this decrease in blood flow causes the brain function to be somewhat slower. In many seniors, there seems to be kind of a lag time, a mere momentary pause between an occurrence and their response to it. Maybe just seconds more are needed for the brain to register what has happened. There is a decrease in the neurons, and this decrease in the number of neurons causes the body's ability to transmit and accept signals to weaken. There's also a decrease in the sensory system, so the ability to sense pain, recognize objects by touching, or detect vibrations in the hand or the feet decreases. To help your client adjust to this slowing, allow more time to respond to questions and requests. Be certain not to rush him, especially while giving personal cares. So many clients report feeling rushed, feel like they are taking too much of your time. Remember, many are very aware that they have slowed down, and they don't like it one bit either. Assist the clients to manage their risk for falls. You want to be certain to provide adequate lighting and remove all trip hazards and obstacles, as clients may not be as steady standing or walking. Here are some gastrointestinal system changes that clients can experience as they age. Often the teeth will loosen and the gums recede. And as changes in the mouth occur, it is more difficult for the person to chew and therefore to digest his food. As mentioned earlier, your taste buds lose their effectiveness. The food that is appealing to an older person may affect their ability to digest that food. The body overall has more difficulty digesting food because of a decrease in digestive enzyme production. There is a loss of muscle tone in the stomach and the intestines, and this causes changes in food tolerance and bowel habits. Diarrhea and constipation can be a result of some of these GI changes. Some tips now for helping clients with digestion of food. I think the number one thing to be aware of is that dentures must fit properly. All clients should practice good oral hygiene and have regular dental exams. And you will want to make certain that all clients maintain proper nutrition. All clients must drink plenty of fluids and eat a diet of high-fiber food. In my experience, oral care is one area that I've seen very neglected, with too many shortcuts. Even though there are dentures, be sure that the mouth is properly cleaned and the dentures cleaned every day. Make certain to alert the nurse if a client has a sudden change in eating habits. It may be because of poor fitting dentures or sores in the mouth, or even a toothache. Clients with dementia will have less ability to articulate what's wrong. With a decreased appetite, foods that no longer taste good, and a reduced sense of smell, many clients will require a nutritional supplement. The last area we're going to talk about are psychosocial changes that an elderly person may experience. What I want to leave you with is that what's true for one person isn't necessarily true for another. There are tremendous differences in people's cognitive and social makeup and their attitudes towards life. There's an expression that says, as you become older, you become more so. And what that means is that as you age, the characteristics you exhibited as a young person will become more pronounced as you age. That's good news for many, because if you've had a positive attitude, a sense of humor, loving relationships, and the ability to cope with and adjust to new situations, that will continue as you age, barring any major brain disorder. As we've looked at all these areas that change in the body as we age, there's lots of things in life you cannot choose. But you can choose your attitude. And I've had the privilege of working with and administering to seniors who are still engaging, interested in others, kind and compassionate, despite significant limitations which they cannot control. In addition to the many physical changes we've talked about, there are also other changes and losses a person can experience as he ages. There can be the loss of a spouse, the loss of children, the loss of home and community, loss of purpose, loss of self-worth, and even financial loss. Many seniors can become depressed with significant changes in their health and the loss of lifestyle. As a caregiver, you'll want to listen to any cues you may hear from a client and report it to the nurse. You may hear him say, "Well, my life is over. There's nothing ahead for me. I don't want to live anymore. Nobody needs me anymore." That's the time for you to sit, perhaps just quietly with him, hold his hand and listen, and then report that to your nurse. I want to note for you just a few aging myths. Let's review some of the common myths together to test your knowledge and understanding about what happens as people get older. The myth is that personality changes with age. And the response or answer is no, personality does not change, given that there is no organic brain disorder. Another myth. As people get older, they become more rigid and resistant to change. Well, the answer is that some do and some don't. This depends on an individual's natural level of curiosity and adventure, but also their confidence to try new things. The myth is that memory loss is inevitable. Everyone who gets old becomes forgetful. Well, that's untrue. As we live longer, a greater portion of our population will have memory issues and dementia, but not everybody. I know people in their 90s who are still sharp as a tack. Myth. It's normal for older people to be depressed. Well, the answer is it's untrue. People handle depression differently, and depression is treatable. The myth is that older people have no interest in intimacy and sex. Well, let me tell you, working with a lot of seniors, that is not true. There are Doris and Danny who walk down the hall hand in hand. He's whistling, holding her handbag, and they go in their apartment and get in bed together. Sexual desire doesn't change with age, but the availability of a partner may. I'd like to finish this training module talking just a little bit about respect for your client, his property, and his family. We talked in the first part about each person coming to you with a unique history, lifestyle preferences, and a social history. Regardless of those backgrounds, every individual deserves to be treated with respect. This population perhaps more than others because they are so vulnerable. They are fragile in many ways, and you are absolutely the key, or one of the important keys, in helping them maintain a healthy, independent, productive, fulfilling lifestyle. I believe that the client and his family is a unit, and you can't really separate the two. You are going to have a wealth of information from the family, and you're going to get to know that person in a very unique way, through the eyes of someone who has known him through all of these different life changes. So listen to the family, work with them, partner with them, all to the benefit of the client. As you think about the aging process, I'm sure some of you are thinking it's a real bummer to get older. And there are some things that are very challenging and difficult. It's said that getting older is not for sissies. But there are also some good positive parts. They can still feel emotion, they can still feel happiness, and they have a rich life story filled with accomplishments. They've seen many changes during their life. Many have experienced a time when women could not vote. They've seen the development of the car, and they remembered the days without computers and cell phones. Put yourself in their shoes. You've got changes in your skin, vision, hearing, taste and smell, muscle and bones. All your body systems have changed a little, sometimes a lot. Listen to your people. If they are uncomfortable and they say something hurts, believe them. Address that situation. If they are not able to speak, then observe them. The nonverbals are often your real clue as to when they are uncomfortable. Validate their feelings. If they are having a difficult day, understand it. Tell them, I understand this must be hard for you. I can understand that. The same with empathy. People want to be heard. They want to feel that there is someone listening to them. You are those eyes and those ears and that loving companion. Make every moment you can count. Leave a lasting impression. You have learned that while we all age, we do it in our own unique ways based on our experiences, our genetics, and our attitudes. Regardless of age, everyone wants independence, respect, and self-esteem. As our body systems age, each person will have to face their own limitations and liabilities, and yet find purpose in living. Some will do it with grace, others will not. Some aging myths have been dispelled, showing that despite added years, there is still that little boy or girl who has many of the same thoughts and feelings as they did when they were very young. I urge you to get to know your clients through their life stories and see them as a whole person who is aging. You can make a difference today. Thank you for your time today. If you have any questions about what you've learned or heard today, please ask your RN or your supervisor for clarification. And now when you are ready, please take your assessment.